Welcome to another episode of the Bandage podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance. In this week's episode, we cover later start times for students, Facebook's push into the healthcare space, in-home doctor visits, and how Uber can help patients get to the doctor. Let's wrap things up. This is episode 5 for the week of November 4th. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is S10.87XA, other superficial bite of other specified part of the neck. Initial encounter.
Well, let me tell you, Matt, this has actually happened to me. You may be surprised to hear. But with it having been Halloween so recently, you know, I like to hand out candy on my front porch and other assorted Halloween goodies to include pencils or erasers.
Oh, you're that guy.
You know, all the real fun things. Don't worry, I still give candy because I don't want my house to be TP'd. But there was this one really rowdy kid who was dressed up as Dracula. And as you know, Dracula is a vampire.
Yes.
And is fabled to suck the blood of his victims. So when I said to the kid, you know, oh, what's your costume? And he just laughed at me. He's like, oh, ha, 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 and then jumped on me and bit me in the neck. So the prescription for that injury, though, was just to rub a clove of garlic on my neck once daily.
Wow. You know, you always seem to have a story that's just crazy. You have a crazy life, Alex.
You know, it's almost election day here coming up in November. And it's got me thinking after this event that, you know, I'm a little disappointed that my yard signs nowadays all have those kind of wire frames because they used to be a nice wooden stake. And, you know, when the vampires came, you had that option right there in the front yard.
True.
So unfortunately, in this case, it ended up with a nice diagnosis of a superficial bite on other specified part of neck.
There's a lot of prepositions in that medical diagnosis code.
It's a tongue twister.
Of other specified part of the neck.
Mm-hmm. Initial encounter, that's the important part.
Yeah, it's true. It's true. We don't want multiple encounters of this. Once you have that garlic on your neck, you're good. That's
Correct.
It.
Correct.
Or you can even wear a necklace of garlic. That's also recommended by your doctors.
Well, that's the thing. I'm not sure I would be able to tell you a story of a subsequent encounter because the garlic's been working for me.
To this day, I have a clove of garlic inside a locket around my neck.
Yeah, sorry about that. It's a prescription clove, okay? You can handle the smell.
And with that, let's get into the news. First headline here, snooze you can use. School districts are pushing for later start times for middle and high school students to help improve sleep habits of teens. A recent California law signed by Governor Gavin Newsom mandates later start times, no earlier than 8 a.m. for middle school and no later than 8:30 a.m. for high school. This is the first statewide response in the U.S. to evidence that chronic lack of sleep impairs teens. Ohio Senator Sandra Williams proposed a bill that would restrict any school, including elementary, from starting before 8:30. Indiana, South Carolina, and New Jersey lawmakers are also making efforts to later start times. Alex, call me old if I say this, but, you know, kids have it so much easier than we did back in the day.
You know, I fall kind of on both sides of this issue because on one hand, I can remember when I was in high school and showing up to school at 7 o'clock in the morning and be ready to work was a challenge, not only logistically in getting there, but, you know, it's exhausting.
It is.
But at the same time, you know, our local school district here in this town, they have one day a week where they start later in the day to give their staff time to hold like a meeting of some sort. And on that day, the traffic in this place is insane. I mean, part of the reason that we want everyone to be at school so early is not because they need to be or we need to start teaching that early, but because their parents then have to go to work after that. And so a later start time would be logistically even more challenging for people who have to go to work and be there by a certain time.
Yeah, I think the whole point of school is to teach you life skills and carry those into your professional life. So if you go into school later and you're taught that your entire life through your middle school and high school years, it makes it a little bit harder to transition into that professional life where you have to come into work at 8 a.m. because that's not changing anytime soon. I understand teenagers are growing and all that stuff, and I mean they're going to be super tired because they have all these different stresses going on. But if they're getting mental health days and on top of that they're coming into school later, it seems like their life is easy.
Yeah, well, if that's the biggest problem you have, then good on you. You got a pretty good life. That being said, I can see kind of the argument for allowing people a little bit more sleep, which therefore could improve their studies, their academic careers. And certainly we want people to be better prepared academically. Mm-hmm. And if it's going to help them academically, then maybe that's something that we should consider. But I'm trying to figure out exactly what the kind of middle ground between being logistically acceptable, especially among a working family, and, being the best academically. Perhaps there's some different way that school could be scheduled so that, the rigorous academics aren't taking place so early. It gives them time to wake up or to have breakfast. I know a lot of places are now serving breakfast to the entire high school. And, that's a great way to start off that day, get them in a habit of some sort. And, when I was in high school, it was really hard to get up that early. When I got to college and I didn't even have to be up that early, it was even harder. Now that I'm past that, I do find it easier to kind of get into that rhythm.
Do you think that if a lot more states propose this and push this into an actual law, that an entire generation of students will have to have later start times for their work eventually?
Mm-mm. Here's my initial thought, and this is just kind of off the top of my head in the moment thinking about it. When I went to school, high school was the first one to start, followed by the middle school, followed by the elementary school.
Yeah.
What if we didn't start high school first? Because think about it. In elementary school, you're not working on academically rigorous courses.
Mm-hmm.
It's some important stuff, but what would the effect be if we kind of flipped that around and had high school starting later? Because those kids theoretically should be self-sufficient enough to get themselves to the bus stop, or maybe even drive themselves to school, and wouldn't necessarily rely on their parents to be able to, access school.
If they start later, do they end later? Because that could have an effect on how long extracurricular activities go on after the fact.
Yeah, that's true. And they probably would.
Mm-hmm. So that's some food for thought, especially if you're in sports, something like football, where football practice is super important and could go on until 8 o'clock at that point.
Yeah,
so
it's not an easy issue. I'm interested to see kind of how it plays out in California and other states, and kind of see if that's maybe the better option. Next up, Facebook prevents health issues with Preventive Health. Facebook is making a push towards the healthcare market with its new tool, Preventive Health, that connects users to health resources and checkup reminders. The tool will offer digital prompts that encourage users to get a series of tests to ensure health. The initial focus is on cancer, heart disease, and the flu. Brand ambassadors believe that the reminders will encourage a proactive approach to health. Users can search which checkups health organizations recommend based on age and gender and where they can receive these tests. Users can mark when tests are complete, set reminders to schedule tests, and share the tool with others to increase awareness.
Now, Facebook, this is the latest big, massive tech company that's pushing into healthcare. It's not really that much of a surprise that Facebook is trying to do this. But what is surprising is that they're doing it only a year after their huge scandal with data. And within this actual article, they say very, very firmly that they are not collecting users' data who participate in preventative health. But it's something that people might be a little bit doubtful of.
Yeah, I think the kind of drive here is to make healthcare a little more social, which is very foreign and strange to me. Like, see your friends are getting checkups. Maybe you want to get one too. I'm not sure how I feel about that.
Get your blood pressure test now because your friends are doing it. It's peer pressure.
It's like back to the election day coming up. In my news feed, it's just like this person and 6 friends have shared that they're registered to vote. and then it gives you a little link to register to vote. It's like, this person and 6 other friends have got their blood pressure tested. How about you?
Yeah, I could eventually see this coming into and being integrated with something like smartwatches, where maybe they get to the point where it's like, hey, you need your blood test, your blood pressure test taken right now. Why don't you do it by pressing this button, and your watch will automatically do it. So maybe that's kind of where this is headed with Facebook.
I can see kind of the social, not so much the social, the technological aspect of kind of preventative health, but I don't see that as being, a Facebook thing. Yeah. I can see a standalone app of some sort that you would have on your phone to kind of track those things, but it's personal. Like,
what would be a Facebook thing to you with healthcare?
Oh, goodness. Just about nothing.
Yeah, right?
I mean, a live stream from a doctor talking about things would be very Facebook.
Telehealth.
Yeah, well, I can imagine that in the future. You just like video call a Facebook page, and that is the doctor's office. Yeah. Oh, my goodness. I'm not sure I'm okay with this. I don't know. It remains to be seen what effect this will have, but I see it as being more effective if it were to be more standalone and kind of sans social aspect.
Perfect segue there, Alex, because Heal right from your home with the Heal app. Heal is an app that brings doctor services right to your home. The app will display different medical services available, and within 2 hours, a doctor or technician will come to your home to provide necessary services. Each visit costs $159, but nearly 20 insurances, including Medicare and Medicare Advantage, report that they'll cover the services. The app will help eliminate patients sitting in waiting rooms for hours before treatment is available. It will reduce patients with illnesses, such as the flu, coming into the doctor's office and spreading the illness to others. This service will also give doctors the ability to see how a patient is living so they can determine if environment may be contributing to the patient's condition. It's currently offered in California, New York, Georgia, and Washington, D.C., or Washington, the District of Champions after the Nationals won the World Series. But beside the fact, Alex, this is kind of similar to, just that whole Uber and Airbnb kind of business strategy where it's like, hey, order now and we'll come and pick you up and we'll do your thing.
It's like the Uber for doctors.
Yeah.
The last bit of that story about kind of analyzing someone's environment in terms of their health reminds me of the old TV show House. And his team would always just go break into people's houses and take a look around and half the time find something that is making this person sick. Now, I get that that's a TV drama, albeit a very good one of my favorites. But the same kind of thing, I could see that being a pretty useful service. And especially, I would much rather wait 2 hours, sitting on my couch watching TV than I do, waiting 2 hours in a waiting room with a bunch of, crying kids and coughing people and stuff like that. That sounds much more enjoyable.
It's just modern day traveling nurse is what I'm kind of getting from it.
Yeah, yep. But with an app to connect you.
It's like...
which presumably takes a cut.
Uber Eats, but, it's a doctor coming your way and charging you $159 unless your insurance covers it, which hopefully they have some type of way where they can say, hey, your insurance covered this. Like now, instantly, right?
Yeah.
Otherwise, I'd rather just go to the doctor's office and spread my flu germs.
Yeah, I suppose it might be really nice for patients that have a hard time getting around.
Yeah.
My immediate thought is older patients, but I'm not sure that they would necessarily make use of a smartphone app.
Yeah.
That is, some kind of new technology in home. They might not accept that as readily, but
I wonder if this is like one of those where they're going to team up with existing traveling nurse companies and use their services and kind of give them a percentage, or they're just going to have their own fleet of traveling nurses or doctors.
Yeah, that'd be interesting to see. I could see here in the near future Facebook just buying this company.
Ah, yes.
Speaking of Uber for doctors, Uber is driving new health advancements. Cerner, a health information technology supplier, has teamed up with the rideshare company Uber to help get patients to doctor's appointments. The Uber Health app will soon be available to integrate into Cerner's electronic health record system. Doctors will be able to schedule rides for patients whenever Uber service is available. A patient's name, phone number and pickup address will auto-populate from Cerner technology directly into the Uber ride request. Currently, 3.6 million patients can't easily access healthcare because of a lack of transportation. This tool will reduce unnecessary costs from overuse of ambulance services for non-emergency situations. It will also reduce the number of no-shows, which delays needed treatment.
This is kind of the answer, Uber's answer to the other story, right?
Mm-hmm.
Instead of bringing people to your house, Uber will come and pick you up and take you to the doctor. Something that's interesting here is that it says that doctors will be scheduling these Uber pickups. Hopefully it's not the doctors and maybe someone who's within the actual doctor's office, maybe a clerk or something like that, because doctors have a lot of burnout as it is because of all the tests that they have to do. So this would add a little bit more workload and could lead to a lot more burnout.
Obviously, it'd probably be the people who are typically in charge of scheduling who would take place in this. Yeah, it's basically the opposite of our previous story. We got Uber for doctors to come to you, or Uber for patients to go to doctors. Your options are endless at this point. And there's kind of a beneficial side to either one, really.
Yeah, I think
being at the doctor's office as opposed to like an emergency room situation.
Yeah,
having a doctor's appointment and going there obviously gives them access to better tools, a better environment for doing medical diagnosis and those kind of things. So I could see that being pretty beneficial. Maybe use one of those services one time and then the other one the next, and kind of go back and forth and get the best of both worlds.
Yeah, and I think the key to success for both of these apps and determining whether or not which will be more successful than the other is how fast they can see patients. So scheduling an Uber to pick you up and go to the doctor is great, but if you have an appointment that's a month away and then you forget about it and this dude just shows up to your house and you're like, what the heck is this? That could be kind of annoying. Whereas with the other app, it's like, hey, we can have a doctor come to your house within 2 hours and they're available right now. That's a lot more convenient. So I think that's kind of the key to success for either of these apps.
Well, if there is currently not an Uber for doctors or patients in your area, some areas do offer services similar to this using their, regional transport groups. I know our local kind of public busing system has rides that they're called Dial a Ride, and you can call in and basically get a ride from basically a smaller bus to doctor's appointments or, to the grocery store or something like that. Now, it's a little more expensive than if you were to, get on the regular old bus and ride that to the next stop, but it is an option. These things do exist. So there might be something like that in your area.
Yeah, it is important to note that public transportation does still exist.
Yeah. Surprising to, well, we live in an area that public transportation isn't as, I guess,
convenient.
It's not the cornerstone of many of our transportation here in our area. Most people have a car and have to drive some distance. But, in other places, bigger cities, more densely populated, they might make better use of something like that for going to doctor's appointments.
With that, let's go to our next segment. BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches. Welcome to Breach Patrol, where we go over the latest cybersecurity news in all of the world. Wow, exciting. First up, we have, excuse me, where's the aisle for breach? The houseware retailer Bed Bath & Beyond disclosed a data thieving cyber attack that led to access of customers' online accounts. The company discovered that a third party acquired email and password information from an outside source that was used to access the accounts. The company notified affected shoppers, less than 1% of the company's online customer accounts, and said that payment cards weren't impacted. It's currently unclear how the attack happened.
I'm willing to make a guess of somewhat how the attack happened.
Bold.
People who use the same password for every account ever, and some organization had a list of emails and passwords, and a group of hackers decided to try them on this specific website because 1% of them worked. Because 1% of people, these could have been older passwords that were actually breached 5 years ago, but these people didn't change their password. They're using the same password for everything. So who knows if this was actually targeted at Bed Bath & Beyond, or if this was a more generalized attack that just happened to work at Bed Bath & Beyond.
Yeah, so something interesting to point out here with this story is they say that payment cards weren't impacted immediately, but if the attacker has a username and password of all these users, then they can just probably go in and look up the payment information right from the account.
Mm-hmm.
So, and also it seems that we've finally found out what the Beyond section stands for.
Next up, fill up on gas and data breach with 7-Eleven. The 7-Eleven app suffered a breach that allowed customers to view the personal information of other users. The app is used to pay in advance for fuel and lock in lower gas prices when they need to fill up. When one user opened the app, he saw another customer's information, including how much money was in the account, the name, email address, phone number, and date of birth. He logged out and back in multiple times, each time seeing another user's information. 7-Eleven took the app down for maintenance after learning of the issue, and the company said the issue has been resolved. Oops.
Yeah, this is definitely a snafu on 7-Eleven's part. But a silver lining here is they say that no bank account information was stolen. So just like last time, but except this one seems a little bit more truthful in that sense.
Yeah, it appears that, for once this breach wasn't some malicious attack and really was just a mistake. And hopefully they've got it cleaned up and there wasn't really too much bad that could have happened from it.
Yeah, I guess the only bad thing that could have happened is that a hacker or someone who had some type of a malicious intent, I guess they're not a hacker in this perspective, but they could just refresh and re-log in and just keep seeing all these different people and their birth dates and all that stuff. So
and recording that information.
Yeah.
Obviously they have their emails and phone numbers too, so.
Yeah.
And that all these people shop at 7-Eleven, so.
It's true.
From a marketing perspective, all you got to do is find a company that wants to target 7-Eleven users, and here you go, a beautiful list that we were able to get from this data breach.
Or from a phishing perspective, you could also figure that out and try to phish these people with their email accounts.
Yeah. Well, hopefully that doesn't happen. It appears they got it cleaned up, and that of course remains to be seen. So, fingers crossed.
Next up, Adobe reputation clouded with Creative Cloud breach. Adobe accidentally allowed exposure of the private details of over 7.5 million Creative Cloud accounts. The users were exposed in a database that anyone could have access to through a simple web browser, putting them at risk of scams and hacks. No password or payment information was exposed, but it's unknown if any data was accessed. This is another example of a company that kind of had a snafu.
Yeah, that's the same kind of story there.
Yeah.
With, whoops, didn't mean to do that, but.
Yeah, but except it's only 7.5 million people. So, it's not that big of a deal.
Only a few.
Yeah.
I'm forever thankful that I'm utterly resistant to switching over to Creative Cloud. I can't bring myself to do it. A subscription service for something that previously I've owned and used unlimitedly for a long time. It's really hard to justify.
Yeah, I mean, I have Creative Cloud, so maybe I was breached. But
probably.
You just got to make sure that if you were one of the affected users, which it seems that they haven't told anyone who they are yet or notified those users, just to be vigilant of phishing attempts. Well, just watch out for those.
You'll know for sure if you get a call here in the next few weeks. It's like, hey, Matt, this is Jim from Adobe Creative Cloud. I just wanted to let you know that your account may have been breached. If you'll please read me your credit card number, then I'll get that fixed for you real quick.
Yeah, if that happens, don't do that.
Yeah, probably don't give him your credit card number.
Nope.
I had a scammer call me the other day, and it's sometimes fun to talk to them just to kind of get a glimpse into what's going on. And the offer was one of those, get 0% on your credit cards for the next year, 0% interest. I'm like, oh wow, that sounds great and totally not a scam. And I started talking to the guy, and I asked him flat out, I'm like, do people fall for this? Like, is this a good business model? And he got all offended. You know, are you calling me a scammer? I'm not scamming people. You must be a scammer. And then he hung up on me. So
I'm not a scammer. You're the scammer. Wow.
Yeah, ouch, got me.
Did you figure out that that's a big realization to realize that all your life you've been a scammer, Alex?
I didn't even know.
Yeah. Wow.
Next up, Network Solutions needs solution after a hack. Network Solutions, the world's first internet domain provider, confirmed that it was hacked. The company determined that a third party gained unauthorized access to a limited number of computer systems, so account information may have been accessed. The information includes contact details such as names, email addresses, phone numbers, and addresses, and the information about the services offered to a given account holder. The company said that no credit card information was compromised, but still encourages customers to monitor their card accounts.
Another instance of no credit card information being accessed.
It's a pretty good week for credit card information because
Yeah.
it seems to be holding itself off for a little
Overall, if you were breached, no worries. Your credit card information is safe this week.
so far, from what we know.
Exactly.
From what we know, it is. So definitely keep an eye on it, but
I wonder if the websites that they were hosting were affected, right? If this is the first internet domain provider, I wonder if they got into domains and messed around with the websites, or could potentially do that in the future, because that would be kind of scary, especially if you're someone like me who works on the back end of websites and tries to build up that SEO.
yeah, and you just come in one day and your entire site has been changed around.
Yeah, right. I wonder if that would be like some type of version of a ransomware attack for a marketer, where it's like, we have your website. If you want your SEO rankings back, give us this money.
We backed up your website, but they just put up a one page that's like, send Bitcoin to this address. Don't do that. Leave my website alone. And that's it for this week's wrap-up of your weekly healthcare news. I'm Alex Ross.
And I'm Matt Moneypenny.
And we'll see you next week. Thank you for joining us for this week's episode of The Bandage. This week's episode was written and produced by Etactics. Etactics is a leading revenue cycle solutions organization committed to providing innovative, web-based solutions that improve our clients' cash management and customer relationships. Thanks, and we'll see you next week.